Hello and a very warm welcome. You're watching India Fights Back with your host Kriti Mishra. Like all other calamities the nation faces, the armed forces of the country have stepped into helping fast track the transportation of oxygen and other medical supplies to the hospitals across the country. Amid the raging COVID pandemic, the Indian Armed Forces are creating COVID facilities on a war footing. Besides providing extensive medical assistance to veterans and their dependents, military hospitals are now providing assistance to the civil administrations as well. The Defense Ministry has also said that 39 cantonment wards across the country are assisting the civil administration. And for deeper insights, I'm joined by Professor N. Mathur, Director and Additional DGHS, Lady Hardinge Medical College, New Delhi, and Major General Ashwini Kumar Sivaj, retired. He's a defense analyst. Welcome to Rajya Sabha Television, gentlemen.
Thank you.
And General Sivaj, coming to you first, treating the current coronavirus wave like a war, the armed forces have launched Operation Co-Jeet to aid anti-COVID-19 efforts. Your opening comments, sir.
Kirti, no doubt about it. You see, the point is today COVID-19 has been a pandemic all throughout the world, and the second wave has taken India by surprise. And we are now to fight against it, and that's why the Indian Defence Forces, which are the best force available, which is there throughout the country, which is disciplined, motivated, and which has done earlier also such type of administration operations, aid to civil authority, is the best force available to the government of India to help out our basically medical community to fight against this COVID-19. Now remember that why this has been done, that today we are finding that we are not able to cope up with the number of the patients which are there all across the country, and our medical facilities which are there are not able to take care of that, and hence the medical facility which are available in the defense forces have been now also opened up to the civilian. This has got three factors. One is to create extra facility. So the certain stations have been now earmarked wherein more facilities have been opened for COVID-19. These are Ahmedabad, it is in Lucknow, it is in Jaipur, it is also in Pune, it is also in Delhi and other stations. And therefore the 50 basically defense forces medical hospital which are there, out of them 42 run by the army, 5 run by the Air Force and 3 by the Navy. They have also opened up almost 15% their facility to the civilians. And in addition to that, the temporary COVID hospital have been also been made in number of stations which will take care of this COVID patient. And in addition to that, this cantonment board hospital which you were mentioning, there are about 60 of them. They have also been now opened up to give facility not only to the cantonment board population but also to the civil population other than of the basically cantonment board. So overall, this is a fight against the COVID-19 for the nation, and hence the Indian Army has risen to the occasion and trying to give this facility to basically fight against it. Another very important aspect is there are certain remote areas which we are not mentioning, that there the medical facilities is either very less or not available. And in this areas, the defense forces are already there and they are giving these facilities. Now they have geared up and they have opened up more facility. Now remember in Andaman, Nicobar, Lakshadweep and all, they are lacking all these medical facilities. Navy has taken lead and they are taking up those medical facilities there. So overall what is happening is a coordination is being done between the Health Ministry and Ministry of Defence to coordinate our resources what are available and also to gear up more resources so that we can take care of this COVID basically facility which are there are geared up, and we can now take care of the people who are suffering from this COVID in a war footing. Now the point which is coming is a war footing is the main thing, because all resources are limited. We are unable to cope up, and in this we all have to rise to the occasion. Now very important point which you have mentioned earlier, which we'll talk later, that the doctors which have taken a premature retirement and also retired, they have been also called back, so that we are no dearth of the doctors as well as the paramedical staff which is available to us.
Absolutely, sir. We'll discuss that in detail. But before that, Professor Mathur, armed forces are creating medical facilities in large numbers. What has been the impact on the ground?
See, I am sure the impact will be seen in few days, and the impact will be large because armed forces do the things in a mission mode. We are also doing the things in the mission mode, but they are more accustomed to doing things in a more disciplined way and in a more focused approach. And what we require from the armed forces is not as much actually treating the patient. What we require is support from outside, all the logistical and the building up the infrastructure, all those things from outside. We do not want our armed forces to be, while performing the duty, to be in any way become endangered with the enemy, which is coronavirus. And for that, we already have the doctors and nurses in place. What we require from the armed forces probably is more of the support from outside, so that the doctors on the ground zero are able to perform the work which they are performing, and they have seamless supply of this material and the equipment and the oxygen and the drugs and other support things from outside. Besides that, they would, because the armed forces is very tuned to, doing the things on the mega projects, very, very big projects. So because we have to now scale up the things to a next level where the things have to be very mega projects. So for that, building up the infrastructure overnight is the forte of armed forces. They can build, bridges or buildings overnight. They not only have the manpower, they have the all know-how, they have material and the commitment. So we are looking forward to having the things from them and all the support.
General Sivaj, he's talking about the expertise that the armed forces have. And probably the Indian Army, the Navy and the Air Force have joined hands together to fight the most lethal enemy ever encountered. Would you agree?
Absolutely. Kirti, basically it's a multi-pronged strategy which has been adopted. First of all, what Dr. Mathur was trying to convey, is the logistics sport. We have realized it that there are a lot of sport which is coming all around the world. A number of countries, almost 50 countries, are trying to send us the oxygen generator, oxygen, basically tankers, and then the cylinders, then the PPP equipment and other medicines. Now they have to be either brought by their own aircraft or by the Air Force, Indian Air Force aircraft. C-17 Globemaster, C-13J Hercules, IL-76, they have been already employed for that. Having got these medicines and equipment in Delhi, then they have to be now ferried to all the other places. Now this is a mammoth task, and this is again been coordinated by the Defence Ministry through basically railways as well as through the Air Force. So these have to go by your Chinook helicopter, and also by other your aircraft like C-17 and C-13J to different stations, maybe Calcutta, Bombay, Pune, Trivandrum. So from Delhi, they are now being sent to that. That is very important thing which has to be done at a war footing, because these oxygen is become a big problem all over the country, where the number of hospitals are finding it acute shortage. We are the one utilizing railway facility in wagons for moving our tanks and as well as guns. That also we have foregone. We want that now the oxygen tankers should move through that. That has been already released so that they can be utilized for moving from station A to station B. Third thing which is done is that, the doctor which have retired recently, 2 years back, they have been called back, also paramedical staff, they will add on, because this facility which has been added, two things which has been done within the defense forces, that all the hospitals, at least 70% of them converted into a COVID hospital.
Yes.
So therefore, their strength of looking after the COVID patient have increased. For example, in Delhi itself, there are two major hospitals. One is the Army headquarters, basically RR hospital, and also the base hospital. Now the base hospital is totally converted in looking after COVID facility. It is increased to almost 650 beds and subsequently increased to 900 beds. And same way, and other station also this has been done, whether it is a command hospital or a lower hospital. In addition to that, number of other hospitals have also opened temporary. Remember this DRDO facility which has opened up in Delhi itself next to the airport is manned by the defense forces doctors only. So we have a pool of doctors which are now, one is the one which we are called from who have retired. In addition to that, those officers who were on staff duty as a medical officer in command headquarters, corps headquarters, div headquarters, they have been also released from them, and they are only taking care of this COVID facility. So this has been also very important issue which is there. And another is the cantonment board, which I said they have also opened for civilian. So overall, it is a multi-pronged strategy which is there done by defense forces. The another issue which we are saying is, one is that we are a committed, disciplined, motivated forces. Order can be given and we will move at the earliest. Second thing, where we have a wherewithal to create an infrastructure in the least amount of time. Third thing is we are the respondent which are available all around the country. And mind you, Kirti, that we understand that the threat on the northern border and western border is still lurking very large. Whether it is from Arunachal to Ladakh against the Chinese, or whether against the Pakistan on the western border. We are not putting our guard down there. We are well committed there. But in addition to that, we have created additional facilities in all other stations so that we can jointly fight against COVID-19. Right. Remember that the whole country has been surprised because this has come as a big jolt and a surprise to all of us. So we all have to rise to the occasion. I'm sure defense forces in conjunction with the civil administration will rise to the occasion and make sure that we fight against this COVID-19 and ultimately win against it.
Absolutely, absolutely, General. But talking about the multi-pronged strategy that you mentioned, there's another important aspect which is about telemedicine. Now, Professor Mathur, this telemedicine facility, of course, by our civil authorities and also by the armed forces, that is being operated by health veterans to provide consultation to those patients who remain at home. This is yet another important step in easing the burden on our healthcare infrastructure.
Absolutely. Telemedicine has got a big boost in last 1 year. Even in civilian side, we had been developing this facility to a great extent and trying to shift as many patients as possible onto the telemedicine. Like for the example, the repeat prescriptions or the patient making the second or the third visit, the regular visit, just which can be done easily on the telemedicine. May not be the first visit where the patient need to be examined in detail, but even for small ailments, even the first visit can be done on the telemedicine. And we had been advertising our telemedicine facilities to a large extent. And there is a lot of scope in further enhancing that, especially the non-COVID related activities can be transferred onto the telemedicine, and the COVID related activities can also be, like counseling the patients and things like that. And the patients who are in the home isolation can be easily done on the telemedicine. And it is a big boost. And I'm sure this is a need of the hour, and this is an opportunity to develop telemedicine to an extent that not only during COVID time, but beyond that also, we use the telemedicine facility and continue to use it, because this will decongest our hospitals and the medical establishments, which is a big need, because the hospitals you see in India, especially the public sector, the government hospitals, are so congested that if there is any infection, it's easily transmissible. So the telemedicine will go a long way, and it will stay even in the post-COVID times.
Absolutely. And talking about another important development, General Siraj, which is about the emergency financial powers. Now, to help the armed forces enhance their capabilities to help the country fight the COVID-19 challenge, Defence Minister Rajnath Singh has given the emergency financial pass to establish quarantine facilities and hospitals. The impact of this important decision in times to come, sir.
Remember, Kirti, what has happened is that the Ministry of Defence has given approval to open up this temporary hospital only for COVID-19. So they need a number of facilities, and for them, we have to buy from the market, and for that, the money is required. And very nice of Defence Ministry, they have immediately released this financial powers have been increased so that this can be bought off the shelf, and all these hospitals are made operational at the earliest. And therefore, this is a very good thing which has happened. A lot of financial power has been increased and money has been given. And so there is no dearth of money. But what is my question is that as a nation, we have to understand that we have been ignoring health for a long. You know, remember the type of money which we are allocating in our budget as far as health is concerned is very less compared to the other countries. And if we have to look after the health, then only we can make sure that in time to come of such type of pandemic, we can take care of it. I'm sure this is a good lesson as a nation which we learn it, that let us now pay attention to health and education in time to come. The other issue which you were bringing out, Kirti, is that, you know, basically is telemedicine. Telemedicine is very important in defense forces. You know, remember the troops which are deployed in Siachen Glacier and all, you know, the specialists can't reach on all the posts which are isolated, where there are doctors and all. So we have mastered this technique of telemedicine, that we can guide and advise them from sitting at the command and corps headquarters to all these, doctors, as well as the battlefield nursing assistant by the telemedicine only. So this telemedicine is a very important thing. And remember, in COVID-19, the mantra is do not leave your home. Out of the population which is there, 85 to 90% population is the one which needs only home isolation. They don't have to rush to the hospital. They only need assurance, and that can be given by the telemedicine, by the various doctors, whether he's a civilian doctor or whether he's a medical officer or the defense forces, because the doctors which we have now, got them not only 2 years, and those who have retired even before 2 years for telemedicine. I think this will be a step in the right direction, because people need assurance. People need, guidance. Sitting at home, 90% of people can be isolated well at home. They don't have to rush to the hospital. Hospitals are not capable of taking care of so many patients, and the situation deteriorating day by day. This can be done if we give a proper telemedicine, so that confidence is given to them that take care of yourself in the home itself. Don't rush it out. You will be given medicine within your own home. You will be given guidance and advice. So a very good step, I feel. I again emphasize on another issue is that remember that all these facilities which have been now opened up by the defense forces, there need to be a coordination between the civil administration and the defense ministry, so that we can optimally utilize this. There are reports coming, sometimes there is a communication gap. This must be taken care of. I am sure that both the ministries will take care of that, and in future we will fight it a joint battle. This is a joint war against COVID-19. As a nation, we have to fight it. And remember, even globe is a community now. Even world has to take care of us, so that we can now, India is one nation which, when COVID one wave came, we have provided medicine to 80 countries. We are the one which we have provided vaccine, not only taking care of our own people, whether it is co-vaccine or Covishield, to almost 80 countries. So I am sure the world will now take care of India when we need their help.
Well, General, you made a very important point about coordination. Let me take that to Professor Mathur. Professor Mathur, he says that we need better coordination between the armed forces and the civilian authorities. What is your take? What is the way ahead?
Absolutely. There is no denial that we need a lot of coordination between the two. And the coordination, I'm not saying that coordination doesn't exist. Coordination exists, but these are this is something unprecedented which has happened. This is in this situation, we are in the pandemic, and not only pandemic, we are in a pandemic emergency. And in that, this coordination has to be of a different level, because usually the coordination between defense and the civilians is for different need. This is first time that it is for the health need. And maybe there could be some gaps between, say, the hospital coordinating with the defense forces. The coordination could have been there more between the paramilitary forces and the military or something like that. That bridges were intact. But these are the new bridges which we have to make between the health system and the defense, because there was no need earlier of this nature. But I'm sure these bridges will come up very fast.
Absolutely. And before we end this conversation, closing comments from both my guests. General Sivaj, we heard for collaboration between the armed forces and the civilian authorities.
Very correct. Very correct, Kirti. It's a multi-pronged strategy, which is a mantra which has to be followed. It is a war-type situation. It is a disaster which has taken place. We are, as a nation, have been surprised. We all need to coordinate. We don't need to panic. We have got infrastructure which is available. We do not have a shortage of so much as much it has been created. That has to be also taken care of. But if we coordinate all the resources and also manage to get those resources which the world is giving us and make sure that it reaches to the needy people, I am sure that in time to come we will be able to fight. We don't have to get panic in any way. The way we are coordinating between defense forces and the civil administration, I am sure in time to come we will be able to take care of the rising situation which is due to this pandemic. Two mantras are there. One is we have to ensure resources have to be optimally utilized, and as a nation we have to rise to the occasion. The people in also has to contribute. It is a public which has to be now basically assist the government to fight against this. This is a fight of a very different type. The nation also need to come out and support the government. Government alone will not able to take care of it unless we have a support of the complete public. I suppose in time to come, we will all rise to the occasion and fight this monster called COVID-19 with a coordinated effort of every individual and every citizen of the nation.
Right, sir. Professor Mathur, your closing comments?
Mike, what I would like to emphasize here is that 95% of the patients will get okay from home isolation. Our effort should be only on those 5% who are sicker and who require, intensive treatment. And we should be just concentrating on them. 90% who are home isolated and who do not, who can get care at home, they can be managed. But right now, in the second surge especially, the number of patients, the absolute number of patients who are very sick has risen to an extent that all the system, all the health facility is overwhelmed. So we have to concentrate on those 10% and not waste, our energies, which should be concentrated. We should be very focused on the sicker,
Right. And of course, we have to fight together against this pandemic. On that note, thank you so much for joining us. So that's all we had for you in this edition of India Fights Back. But before that, let me remind you once again to stay safe from this coronavirus pandemic. Remember to wear a face mask and wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. These simple precautions are all it takes to defeat this pandemic. Take care and goodbye.